I'm Rochelle De Vera from BSN 2A Group 2, and today I'm going to demonstrate the administration of enema. And for the purposes, first, it is a technique used to stimulate stool evacuation. Second, it is a treatment used to relieve severe constipation. Third or last, it is the management used for cleaning, carminative, retention, and also a return flow. And now let's proceed for the preparation. So in preparation, we have the assessment. So first thing we need to do is to assess our patient's last bowel movement, amount, also the color and the consistency of the stool. And also if there is a presence of a abdominal distension, and whether our patient has a sphincter control. And last, we need to know the availability of our patient to use toilet or a commode or bedpan in bed. And then now let's proceed for the planning. So in planning, first we need to do is to determine whether there is a presence of a kidney or cardiac disease that contraindicated or contraindicate our use of administering enema. And also the doctor's order for it is the need or order for all the things that we need to do for the administering enema. And now we need to prepare and assemble all the equipments that we need. So we have here the bath blanket or towel. We have also the clean gloves. Also we have here the disposable linen. And we have also the paper towel. And we have here the water or any soluble lubricant, and also we have here the commode or bedpan, but let's say for instance it is, but it is not. And then we have also here the right solution, amount, and temperature of enema, and this is the tools that we are going to use, but this is not the actual material that we need to use for enema, but let's say for instance it is. And before we proceed for the implementation, first thing we need to do is to put the right solution and amount and temperature of enema to the drainage. So let's say for instance, and then make sure that you close it. And now let's proceed for our implementation, and by doing that, we need to prepare first the lubricant, about 5 centimeter or 12 inches for the rectal tube. And let's say for instance that this one is up here, so let's just imagine that this one is located here, but as I don't have a stand, so I'm gonna put that there, but it should be up, okay? And then run some solution through the connecting tubing of a large volume of enema set, and the rectal tube to expel or any air in the tubing, then close the clamp. So we need to close the clamp. And then prior by doing this procedure, first thing you need to do is to you need to introduce yourself to the client, and you need to identify your client. So then we need to explain to our client what we are going to do, why it is necessary, and how he or she can cooperate with us. And then by indicating the client, you need to indicate to the client that he or she might experience feeling fullness while the solution is being administered. And then we need to we need to perform hand hygiene. So if you have the chance to wash your hands, so you need to wash your hands, but you can also use a alcohol or sanitizer and do some other appropriate infection control. So you can put a clean gloves, and then you need to provide your clients privacy. So if you are in the room, make sure that you close the door, and if there's a curtain, you need to close the curtain. And then after providing the privacy of your client, next thing you need to do is you need to assist your client to a left lateral position with the right leg at actual flex as possible, and the lining or saver pad under the buttocks of our client. So, sir, let me help you. And then we need to put the underlining. Sir, let me help you. Okay. And now we are going to insert the enema tube. For the client in a left lateral position, you need to lift the upper buttocks and then insert the tube smoothly and slowly into the rectum, directing it toward to the umbilicus. So you need to insert the tube for 7 to 10 centimeter or 3 to 4 inches. And then if the resistance is encountered at a internal sphincter, you need to ask the client to take a deep breath and then run a small amount of solution through the tube. But never force the tube or solution entry if instilling a small amount of solution does not permit. Freely withdraw the tube. Then you need to check for any stool that might be block the tube during the insertion, and if it is there's a present, you need to flush it and then retry the procedure. If the resistance persists and the procedure, and you need to report the resistance to the primary care provider and also for the nurse in charge. Then you need to slowly administer the enema solution. You need to raise the solution container with open, and then you need to open the clamp to allow the fluid flow or compress a pliable container by hand. And then during most low enema, you need to hold or hang the solution container no higher than 30 centimeter or 12 inches above the rectum. And then during the high enema, you need to hang the solution container approximately for 45 centimeter or 18 inches above the rectum. And by administering the fluid slowly, if the client complain of the fullness or pain, you need to lower the container or use the clamp to stop the flow for 30 seconds and then restart the flow at a slower rate. And then if you are using a plastic commercial container, you need to roll it up as the fluid is instilled, and then after all the solution had been instilled, you need to, when the client cannot hold anymore, and then feels the desire of defecate, you need to close the clump and then remove the rectal tube from the anus. And then place the rectal tube in a disposable towel as you withdraw it. So here, so I'm going to withdraw it now slowly. Then put it in the towel, and then you need to dispose it. As you dispose it, you need to encourage the client to retain the enema. And then you need to ask your client to remain lying down, but you need to help him or her so comfortable. And then you need to request that the client retain the solution for the appropriate amount of time, for about 5 minutes to 1 minute, I think, for cleansing the enema, and then 30 minutes for the retention of the enema. And then after that, you need to assist the client to defecate. So by assisting the client to a sitting, you need to assist your client for a sitting position on a bedpan or a commode or on the toilet. So, sir, let me help you. And then you need to observe the feces on the bedpan and then for the commode or the toilet. Then if the specimen of the feces is required, you need to ask the client to use the bedpan or commode. Then after that, return to the bed, then help him or her again. Then you need to dispose this one, this pad, and also your clean gloves before, or your gloves. You need to dispose it. Okay. You need to perform hand hygiene. So by that, you need to wash your hands, or much better, wash your hands. But I'm just going to use a alcohol. And for the variation of administering enema into a inconsistent client or patient, the procedure for that is, for a rectum, flow enema, the solution is 100 to 2 ml for adult, is instilled into the client's rectum and sigmoid colons. And then for the solution container is lowered so that the fluid flowed back out through the rectal tube into the container and pulling the flatus with it. And the inflow and outflow process is repeated 5 or 6 times, and the solution is replaced several times during a procedure if it becomes becomes thick with the feces. And for the evaluation, we need to document the procedure, the type and volume, if appropriate, of enema given, and the type of solution, length of time solution was retained, the amount, color, and the consistency of returns, and the relief of flatus and abdominal distension on the client's record. And we need also to observe for possible reaction to the administered enema.